Hello, my name is Saúl Preciado Garcia. My mother was a patient at City of Hope, and the following are the reasons why City of Hope is a bad hospital. Number one, they don't talk to you with the truth. They deceive you. They hide information that you need to know in order to either accept or not accept a treatment. They hide information. They lie to you. Number two, they discharge you. To number three is that there's a conflict of interest. Many nephrologists in that hospital own the dialysis companies, which that creates a conflict in regards of if you need another type of treatment, they will try to give you the treatment that you do not need in order for them to gain money from you. City of Hope, everybody needs to understand that City of Hope is a research hospital, meaning that they basically research they basically they treat patients as guinea pigs. So basically, in order to do research, they experiment on patients. So that's something that everybody. I was looking at the documentation of my mother yesterday because I'm trying to sue City of Hope on my own because it's hard to get a lawyer because of the MICRA MICRA law that limits the amount of money that you can get from a deceased patient. So basically, no lawyer is gonna get. It's very difficult for a lawyer to get a case of wrongful death unless the patient is alive, and that will not be wrongful death; will be personal injury because of that cap that the law limits of the amount of money that you can get from the hospital. So therefore, it's very important for everybody to read every single document that they give to you. They hide information. They hide with the purpose of lying. For me, hiding information is lying. So people cannot take a wise decision in regards of if allowing the treatment or not allowing the treatment. I was involved with my mom 100% on the treatment and every I was the decision maker for my mom. So basically I know I realized that they lied to us, that they didn't tell us the truth about the consequences of the treatment. And I just realized that basically you're signing a document, like a small print that states that you're basically acknowledging that it's a research hospital and that they basically they're gonna visit you. Students are gonna visit you. Anybody can visit you and look at you in a very poor state that you're gonna be after the surgery or the treatment. That they don't clarify that in detail when they are telling you what they're gonna do and so forth and so on. So basically, first of all, they hide information. Again, examples are they didn't tell us the consequences of the surgery in detail. The only thing that they tell you is that there's a 50-50 chance of survival. They don't go into the details. What happens if you survive? What happens to your tissue? What happens to you? Fistulas. They never explained us about fistulas. My mom developed fistulas. They never told us that liver, that basically because of the infections that you can get due to the treatment, all the antibiotics, they're gonna kill your kidneys. So basically, they never tell you about the possibility of kidney failure completely. So they hide a lot of information. And on top of that, I investigated two other people, two other cases, two family members. They gave me all the documents and so forth and so on. So I detected some mistakes in all the documentation. And the reason why I detected, I'm not a doctor by all means, but I went to nursing school for at least one semester, but I took a lot of classes, microbiology, anatomy, and physiology. So I kind of understood all the documentation to a certain valid point. So basically, those family members, they told me that they were pressured. They didn't. The loved ones, the ones that are dead now, they didn't want to go to the treatment. But City of Hope was pressuring them, calling them, harassing them. I mean, if you don't do the surgery, the treatment, we may not do it later on. You need to decide right now. And they will say, no, we're not interested on that. They will hang up and they will still call them and call until they say yes. So there was peer pressure, meaning that in my understanding, they need people to experiment with. So they're gonna call and call and call until they misguide a person to accept the treatment that probably is not the right treatment, and it's gonna end up with the person's life. And I have a video explaining every single detail of what happened with us with my mother and what happened with those two other people that they end up dying, suffering, because they suffer. My mom suffered for 9 months horribly, horribly, to the point, and I'm gonna say in this video so everybody will know, to the point that she defecated from her mouth. So it was horrible what my mom went through, and not only my mom, but we went through psychologically, because that's a trauma that I'm gonna I'm gonna remember everything until I die, which is very psychological, is very horrible. On top of that, City of Hope discharges people from ICU to regular rooms with disregard of their condition. My mom was not supposed to be on a regular room. She was she was in a very critique state. So they took her out of ICU because they engaged in so many surgeries that they don't have space for people on ICU. So the easiest thing is for them to just discharge patients to regular floors, and that's where my mom got the heart attack that ended up her life, basically, because she wasn't a regular floor when she was supposed to be in ICU. That was one thing. There's a thousand things that I can talk about City of Hope, but I'm saying the most important ones. And then not only that, to reduce the mortality rate, the hospital mortality rate, as soon as they discharge the patient, they just wait a couple of days or whatever, and then they discharge the patient to convalescent homes. So they discharge patients outside the hospital with disregard of their health, of their physical condition. My mom got discharged from the hospital, and she had abscesses on her stomach. That's the reason why she started defecating from the mouth, because she had blockage, intestinal blockage. And I checked my mom's abdominal cavity to see and to find out that she's okay, because she hasn't had a bowel movement for days. They ignored me. They said that she was okay. I refused to sign discharge documents. The RN, the case manager, she made my mom sign in English when my mom did not know English. She just knew Spanish. So she made my mom sign a document in a foreign language because I refused to sign the discharge document. She didn't advise me about the appealing process, because you can appeal the discharge. She didn't advise me about the appealing process. And as soon as, because I went to the bathroom, I told the RN, you know what? I refuse to sign documents until you guys check my mom's abdomen. I'm gonna go. So I just went to the bathroom, and she right away, she went for the documentation. She went inside the room. She talked English to my mom, which she did not understood. And she was 70, 78, 70 years old. An elderly person is gonna agree to whatever they say. So she made my mom sign discharge documents. I came, and they kicked us out of the hospital. 4 days later, my mom was dying. Because she got a very severe infection because of the abscesses that she had, the bowel abscess, the abscesses that she had on the bowels. And they were, according to the doctors, they were huge, and those abscesses developed through weeks. Not just they didn't develop in 1 day or 2 days. They were like at least 2 weeks of development. So the hospital discharged my mother with abscesses in her abdomen, lying to her. Well, not lying to her. Sorry, making her sign documents in a foreign language, and basically, yes, lying, because they told us that she was okay, that she was ready to go to another hospital. And doctors in the other hospitals, we went to San Diego. Doctors from the place that she was discharged at, the doctor told me, you know what, City of Hope, I don't know why they did this surgery on your mom. It was out surgery that it was not meant to be for you because of her conditions. She had diabetes, blah blah blah. They were not supposed to perform this surgery. Basically, they just let discharge your mom so she will die in another hospital. That's what one doctor told me. Then we went to my mom when she got the infection. She was transferred to another hospital, and the hospital told me, you know what, that surgery was not meant for your. It was not the proper surgery for your mom. And they were blaming because my mom she was a Jehovah's Witness. She didn't accept the blood. The doctors at City of Hope are so coward. They're cowards that they blame everything to the blood. The doctor from the Sharp Hospital told me, no, blood has nothing to do with with this situation. The thing about the problem with your mom is that she was not a candidate for surgery because tissue that goes through radiation and chemotherapy does not heal. Once you cut that tissue, it doesn't heal. The mistake that the City of Hope doctors made was that they didn't took that into consideration. That your mom's tissue was not gonna heal, regardless of because of the chemotherapy and radiation she got prior. So basically, they even lied to us, blaming. They're so coward that they're gonna blame the death or the severe health to anything except them. Even my mom's doctor, when we came back. Oh, another thing that people need to realize and understand is that when a hospital does a surgery, and if they make a mistake, no other hospital is gonna fix that mistake. We did not want it to go back to City of Hope, but no one, two hospitals refused to provide treatment to my mom. They told us that she needs to go back to City of Hope. They need to fix the mistake. Unless they refuse, then we have to intervene. But as long as they don't refuse, we cannot accept your mom. And of course, City of Hope didn't refuse. Why? Because otherwise they will be liable for mistakes. I mean, it has to do with something with legality. So they say yes. So we have to go back to City of Hope. And again, they had to do another surgery. The doctor that connected tissue that it was with radiation, he wanted to do the same thing again. And I told the doctor, no, doctor, you cannot reattach each tissue that has been already radiated in chemotherapy. That's what the other doctors in the other hospitals told me. He got offended. He told me, well, I'm the doctor, you're not the doctor, blah, blah, blah. So you don't tell me what to do, basically. So basically, at the end, when they did the second surgery, he did what I told him to do. Which, I mean, I'm not gonna go into detail because it's a lot of information. But my mom's doctor, he's such a coward, Mark Wakabayashi. He's such a coward that he blamed everything that my mom suffered. She blamed everything to me. He told me, it's your fault. All this is your fault. After my mom, when my mom was in very critical condition, he said, all of this, everything happened because of you. Like I was the one who decided to do the surgery on my mom. And again, that's only like, I gave you guys, I gave you like a very small percentage of everything that happened. Another thing that happened that people do not know is that the nephrologist, because my mom's kidneys died, because my mom was admitted, if I'm not mistaken, with 20% of kidney function. There, by just that, it's by itself, my mom was not a candidate for surgery because all the infections that she was gonna get, all the antibiotics that she was gonna get because of the post-surgery situation, they were gonna kill the kidneys 100%. And they didn't tell us that. I find out as time progressed, and I was able to research on my own. So that's reason why, number one reason why she was not a candidate for surgery, besides that, a lot of stuff. But the nephrologist that took care of my mom, Dr. Amna Rizvi, the machines, because that her company or her family's company were the ones giving were the ones giving my mom dialysis. So basically, the hospital subcontracts dialysis companies to provide dialysis to patients. So the nephrologist either was co-owner, or if she was not the owner of the company, her family owned the company that provided dialysis to my mom. So, which is a conflict of interest. And why is it? Why am I mentioning this? It's because the nurse that was doing the dialysis ignored to act on time, And my mom had a very low blood pressure. He took my mom's blood pressure like 8 times or 7 times. If you see, I trained again. I was accepted into nursing school. I went 1 semester to nursing school. I worked in hospital for 7 years. I know after you take a blood pressure, I know by inertia that if the patient's blood pressure is low, you right away you act and you communicate that to doctors right away to prevent a heart attack. My mom's blood pressure, when I went inside the room, because he was texting, he was when he was doing the dialysis, I came back to the room. I went out and then I came back. He was texting and he was not paying attention to my mom. Well, when I saw him, when I was putting my gowns for infection control, because to get into my mom's room you had to put gowns and gloves and whatnot. So when before going inside the room, I saw him texting and whatnot. So I took my time putting my gowns and whatever. So when I went inside the room, he was taking my mom's blood pressure. The machine was going crazy. So my mom's blood pressure, to best of my knowledge, it was 30/60, which is extremely low. A normal is 80/90, the low normal. The normal is 120/80. No, 80/120. And my mom's was 30/60, which is it was an incredible low blood pressure. He took my mom's blood pressure like 7 times. He took it from here, he took it from here, and then he went to the legs 2 times, and then he went back to the other leg. So I was thinking, what I was paranoid because because of my mom's blood pressure, the machine was going, they were going crazy. So I told him, "What are you doing? What's going on?" "Oh, don't worry." He just laughed. "Oh, don't worry. It's just the blood pressure machine doesn't work. It doesn't work." And I was thinking, well, into myself, I mean, if the the blood pressure doesn't work, you go right away and you get another one, right? So I went outside the room. I grabbed a new blood pressure machine. A nurse told me, "What's going on? My mom's blood pressure is very low." Then not even the nurse of my mom, it was another nurse, because the nurse of my mom was talking. I don't know where she was. So we went inside the room, and my mom didn't have a pulse. So she was dead already. We didn't have a pulse. So they resuscitated my mom. And then she was transferred to ICU back again. Everything was like, okay, she's gonna be okay, blah blah blah. But that heart attack that killed my mom, that basically took away the vitals, gave her an aneurysm. So multiple aneurysms. So revive her. Whatever substance you inject, adrenaline, I guess, to make the heart pump again, gave my mom, because of the high blood pressure, it gave my mom multiple aneurysms. So basically, my mom, the doctors told me, "You know what? There's nothing we can do about it, because your mom is in a very bad state, and now we have to worry about doing surgery on the brain and blah blah. You just have to let her go." So basically, we had to decide and just let her go. But all that happened because of the dialysis nurse, that he was not doing his job properly, and he took the. I told that even the heart doctor came inside the room, and I told the doctor, "What happens if you do not report low blood pressure on time? If you take the vitals like 7 times?" The doctor told me, the patient dies. You get a heart attack and the patient dies. And that's what happened to my mother. And the nurse, again, I'm saying this because the nephrologist came to my room afterwards and she told me, "Oh, your mom died because she was so weak." And then my mom's doctor came too. "Oh, your mom died because she was too weak." And I told them, "No, she died. She got the heart attack. And all this because the nurse was not doing his job, the dialysis nurse, because he took my mom's vitals like 7 times and he didn't act on time." And the worst thing that of this situation is that my mom had a witness. When all this happened, there was a one-to-one nurse checking everything, checking that my mom, I mean, supervising my mom 24/7. So all this happened in front of that nurse assistant. And when the nephrologist came to my room and told my mom, told me that my mom was weak, I told her no, because this and this and this happened. And the assistant was there, so I told the assistant, "Right?" I don't remember her name, so I told her, "Right? Right? Or am I wrong?" And then assistant told the nephrologist, "Yes, that's what happened. Everything that that Saul says, that the son says, is what happened. So the nephrologist looked at the assistant with eyes like she was gonna kill her, basically. And right away she left, and they removed the assistant from the room. And I never saw the assistant anymore. So basically, she got upset because the assistant validated what I said, and the nephrologist got upset because the nurse that took my mother's vitals like 7 times, that nurse was her employee or her family's employee. That nurse worked for the dialysis company. So the dialysis company owned or co-owned by the nephrologist or the family of the nephrologist. So see the conflict of interest there in that type of situation. That was like the worst thing. That's the reason why my mom died, because they were saying, "Oh, your mom's gonna leave," blah blah blah. But my mom died because of a lot of neglect, and the first neglect was doing the surgery on her, because she had another option. She had an alternative. They were gonna give her chemotherapy instead of the surgery. But they talked to us with so much hope. They told us, they almost guaranteed that everything was gonna be okay, that we decided for the surgery, not the chemotherapy. Also, the fact that they didn't tell my mom about the fistula she was gonna develop. They didn't tell my mom that tissue does not heal. They didn't tell us so much information that could have made us make a better decision and not agree to the surgery. And that's the reason why all these events took place. If my mom would have gotten the chemotherapy, she would probably be alive today. Or probably, a lot of people, like, you can engage into alternative healing treatments that may work or may not work. But I mean, that's gonna be your option. But when they decided to do the surgery, and they did it, they took away any options from us. And again, that's basically a very brief summary of what happened with this hospital. And again, it's not just me. A lot of people are complaining about them lying to you, not telling you what's up. The people that I interview later on, again, the people that died, they were never told about infections, about the fact that the kidneys may die because of all the antibiotics that they were gonna put in the body. They were never told about a lot of stuff, a lot of stuff. So that hospital lies, deceives, and use you as a guinea pig for people to know about this hospital. And I'm trying to save life, prevent suffering. That's what I'm trying to accomplish. I don't want people to go through what me and my family went through, what my mom went through, because defecating from your mouth, I mean, come on. I don't want anybody to suffer what we suffer. Right now, I'm trying to sue the hospital. So I need anyone that was wrongdoing by this hospital. If you're there, if you can please contact me, so we can really take down this hospital, because we need to do something about it. And I mean, my email is Saul_Preciado, Preciado @hotmail.com. Send me a message. Let's talk, and let's do something about this, because I lost my mother. No money in the world is gonna, nothing in the world is gonna bring me my mom back. So I'm pretty sure that if you lost a family member, or if you were injured severe in that hospital, please contact me and let's do something about it.